leg. It hurts.
Hi, I have an appointment with Dr. Jen today.
Okay, you can have a seat in the waiting room. She'll be right with you.
Thank you. Meg, how's it going today?
It's going okay. How are you?
I'm doing pretty good. What's going on?
Not too much. I just have a couple concerns I want to talk about.
Okay, how's school going? Bloomsburg, right?
Yeah, I go to Bloomsburg. It's going pretty good.
Awesome. So what's going on today? It's been about 6 months since I performed your surgery. We did a below-the-knee amputation of below your right leg. And luckily I was able to keep a lot of the nerve tissue, your skin, and then a lot of the blood vessels too. As you can see from your x-ray here, this is where your amputation was. It was right beneath your knee. And so, what's going on today? How are we feeling?
A month after my surgery, my incision finally healed. There's a little bit of pain in those couple weeks, but it eventually subsided. But my concern was I woke up these past couple weeks in the middle of the night with pain in my right leg below my knee, but I don't even have a leg there.
Okay, so I see that after your surgery, you were covered in the ICU for about 10 days, and then you went through rehabilitation and physical therapy. And so it sounds like what you're suffering from is something called phantom limb syndrome. And phantom limb syndrome is exactly what it sounds like, what you explained. It is the ongoing sensation of pain in the limb that has been amputated. And this usually occurs a few months after surgery, so it's not surprising that you're experiencing this.
Why is this happening to me?
Well, unfortunately, we don't know the exact cause of why this happens, but it happens to a lot of people very shortly after they have a limb amputated. We think it might have something to do with your nervous system. Before you get your amputation, your central nervous system, which consists of your brain and spinal cord, sends and receives messages called nerve impulses to and from your leg. And it controls everything. Your central nerve system controls every step you take, when you walk versus when you run, how you bend it. It controls all your movement. And now that we've amputated your leg, we severed the communication between your brain and spinal cord with your leg. So now your brain is sending signals to your leg, which is called your motor output, but it's not receiving any communication back, and that we call our sensory input.
So my brain is basically just like confused on what's happening?
Exactly. So it's responding in the only way it knows how to, which is pain. And even though I was able to salvage a lot of the damaged nerve tissue, I still disconnected the communication from your leg to your spinal cord and brain.
So what do I do about my phantom limb pain?
Well, unfortunately, since we don't know the exact cause of phantom limb pain, we don't have an official treatment for it. But there are a few things we can do to help with the pain.
Like what?
So first, we can continue giving you pain relievers, over-the-counter pain relievers like Tylenol, ibuprofen, Aleve. And if that doesn't help, I'll prescribe you something that's a little bit more stronger. But something else you could try is acupuncture. I know it sounds kind of weird, but a lot of studies have shown that when we insert acupuncture needles into the specific area that's causing you pain, it'll help you relieve that pain. And I also want you to continue doing your physical therapy.
Will I have to get surgery?
Fortunately, I don't think we'll have to do surgery, only as a last resort, and I'm really confident that we won't have to do that, and it shouldn't come to that.
Okay, I hope not either. Thank you, doctor.
Of course.
Limb is just like any other limb that you would feel, except it isn't actually there. Phantom sensations are feeling body parts like arms or hands that aren't on your body. This sounds crazy, and it kind of is, but 60 to 80% of people who have lost a limb report phantom feelings throughout their life, most of which are painful. And almost 100% of people report phantom sensations immediately after having lost a limb. So how does this happen? Well, first we have to understand how we normally feel things. Every body part is connected to specific neurons in the brain. When you detect a physical stimulus, when you're touched, that body part immediately sends a signal to its corresponding neurons in the brain. And when that signal is interpreted by the brain, that's when you actually feel the stimulus. But when you lose a limb, no sensation is given to this part of the brain anymore because there's no limb to be touched. It turns out that when neurons in the brain are really inactive for a long time, the neighboring regions want to expand and fill that void. So what happens next is a sort of reorganization of the brain's neural connections. The active regions that are being touched and stimulated literally start to take over the inactive regions. This process is called neuroplasticity, and until very recently most people assumed this wasn't possible, that our brains were permanently hardwired and unchangeable. But we now know that the connections are malleable, plastic. Okay, so neighboring neurons have moved into that region, but now what? Let's assume we lost an arm, and the corresponding neurons in the brain eventually become inactive. We know that the neural region closest to this contains the face, so the face's neurons eventually move into the region that before stimulated the arm. This means that whenever certain parts of the face are touched, we would experience that sensation not just in our face, but in our phantom limb too. Here you can see a picture of scientists diagramming where parts of the hand and arm are on someone's face. And similarly, if someone lost only their lower arm, it's likely that the neurons of their upper arm would expand and start to feel that lower arm too. This theory that experiencing phantom limbs is due to the reorganization of neural connections is largely derived from the work of psychologist Vilayanur Ramachandran. And he also believes that every human has a neural template from birth, describing how the body is supposed to be connected to itself. He worked with one particular woman who had lost her hand in a car accident, but this woman was actually born with 4 fingers on the hand she lost. Despite this, Ramachandran was able to help her feel 5 phantom fingers even though she had only ever had 4. That blows my mind. Now, despite the explanation I just gave you, there is still debate over the exact reasons that phantom limbs are felt. Some argue that the reorganization of neurons isn't as important, or that it only explains why people experience pain and not normal sensation. Even Ramachandran says that while it may be an important component, we can't be sure that it is the only or most important reason. Another study found that injecting anesthesia into nerves found in our backs, not our brains, helped lighten phantom pain. Overall, this research is incomplete, and there is still much to learn. But I'm sure we'll keep discovering and understanding crazy, awesome things about our world. I'm Matt from the channel Conjecture, and thanks for watching.
Phantom limb syndrome is more common in females rather than males and is also more common to occur in the upper limbs rather than the lower limbs. War veterans and individuals who have had traumatic experiences are more common to develop this syndrome. 50 to 80% of patients develop this syndrome after amputation, and these individuals experience pain such as cramping, stabbing, stinging, or shooting or burning pains, which can last for as low as 2 months for up to a year.
As said earlier, there is no cure for phantom limb syndrome. However, when medication and therapy is combined, it forms what's called medical therapy. One form of medical therapy is called the mirror box. The mirror box consists of 2 holes, one for each leg, and mirrors that make it look as if the missing limb is there. The patient will then perform a series of exercises using both legs. The idea behind this is that if the patient observes the missing limbs moving, it will help alleviate some of the pain. Another form of medical therapy is called spinal cord stimulation. Electrodes are inserted along the spinal cord and small continuous electrical currents are delivered that should help alleviate the pain.